Proposed law which would give the government the power to override parts of the Brexit agreement with the EU has passed the first test in the House of Commons.
Ministers say the Internal Markets Bill contains vital safeguards despite fears it could be in breach of international law.
Our political correspondent Chris Mason is in Westminster for us this morning. Chris, good morning to you. So a bit of opposition from inside the Tory party about this one. What is the next step for this bill now?
Yeah, morning to you, Dan. I'll talk you through the numbers. A government majority last night of 77. They have a majority normally of 80. So you might think, well, hang on a minute. After all of that brouhaha, isn't this rather a lot of cherries and not much cake? But when you listened to the debate yesterday, you got a sense of the scale and the breadth of the opposition, not just from the usual suspects, the opposition parties, but from quite a lot of Conservative MPs, including those who have backed Brexit right from the start, but are really nervous about this prospect of the UK choosing to break international law. So last night he was on the blower to Conservative members of the upper chamber, trying to persuade them. He was pretty robust by all accounts, but there's still plenty there, including the likes of Michael Howard, Lord Howard, former Conservative leader and a lawyer, who simply do not like the whiff of this, that idea of breaking international law. This is a government, Dan, that likes to take a look at a convention and smash it. It likes to be quite noisy. There's more noise on this still to come.
Thank you for the moment, Chris, and we'll be speaking to the Home Secretary, Priti Patel, about that and numerous other issues, and putting some of your concerns about the current testing situation in the UK to her at 7:30. She'll be here in about 20 minutes' time.
Plenty of fine, dry weather in the forecast.
I'm back with the latest from BBC London in an hour. Plenty more on our website, Facebook and Instagram. Now, though, it's back to Louise and Dan. Bye-bye for now.
Hello, good morning. Watching Breakfast with Louise and Dan this morning.
It is just after 7:30. Let's return to our main story. And the lack of coronavirus testing is leading to staff shortages across the NHS. This is according to a warning from hospital bosses.
They say the situation is putting services at risk, and live on BBC Breakfast by the Home Secretary, Priti Patel. Good morning to you. Thank you for being with us this morning. We will talk to you about police recruitment, which I know is what you're here to speak about this morning. But I wanted to start with an issue which is of real concern to many of our viewers this morning. The problem with getting testing in many parts of the United Kingdom. Can I ask you first of all, Home Secretary, what to your mind is the problem? Are we looking at a shortage of actual tests? Is it a backlog in those tests being analysed, or is it a staffing issue? What is the problem?
No, well, what we are seeing increasingly more local lockdowns, and to be quite candid, we're obviously seeing rates of coronavirus go up. And we've been saying now every single day, we've been saying this for months, but we are restating this again, that if people are symptomatic, it's right that they get a test, but also laboratory capacity as well, to make sure that we can obviously get the results of those tests.
But there are,
and alongside that, of course, there's a lot more mobile testing that's taking place, particularly in lockdown areas, and also in the areas where we need to get people tested.
OK, you talk about those people being needs tests, particularly in those areas that require that. Let me give you an example of Bolton. Now,
Well, look, I think the reality is, I mean, I can't speak specifically.
But that is the reality. You can't get a test in Bolton at the moment. In fact, the top 10 worst coronavirus hotspots in England at the moment, there are no tests available.
Well, you've already heard me say that tests are available. You've heard me say as well, particularly in local lockdown areas. You know, I've seen this myself. I've seen the teams that have been working on this. Mobile testing is going in, capacity is going into local areas where lockdowns have been undertaken and are taking place. So I think it is wrong to say that tests are not available down areas. That has been a consistent way of working and a consistent pattern since we've had the local lockdowns. And as we know, where there are spikes, where we've got local lockdowns, we also have more staff with Public Health England going into these local areas to make testing available and to ensure that the people that need testing, and let's not forget, through the local lockdowns, we have the Joint Biosecurity Centre.
Secretary, you say you don't know of people not being able to get tests. We went filming in Oldham yesterday. Let me give you some examples. Okay. There are so many people contacting this programme who I would imagine cannot believe that you're sitting there this morning and saying there is not a shortage of tests.
Well, I haven't said there's not a shortage of tests. What I have said is that we are surging capacity in areas where we've had local lockdowns. And what I would say is clearly the examples you've given are unacceptable. And clearly there is much more work that needs to be undertaken with Public Health England and the actual public health bodies in those particular local areas. And, you know, as a government, obviously, we work with Public Health England to surge where there is demand in local hotspot areas. And we continue to do that. And I have to say, you know, if I can pick up those particular cases that you have mentioned, then clearly we will do that and work with Public Health England. There is a need, obviously, to grow capacity, increase capacity. That is something that is taking place every single day. You've also mentioned about people not getting access to appointments, booking slots. More and more booking slots are coming on stream, available within a 10-mile radius. Now, it seems to me that there'll be extreme cases where people can't get to test locations within that radius, but that doesn't mean that, you know, Public Health are growing their capacity and ensuring that more testing capabilities are available on a daily basis.
And I'm sure you're aware, Home Secretary, that there's a big difference between capacity and the ability to process those tests, which I think is the frustration that many people are finding. Can I speak to you about NHS providers? Their CEO, Chris Hobson, this is what he's had to say about the inability of some NHS staff to get tests at them, when they will be available, and making sure NHS staff can work with winter to come.
Well, I think, first of all NHS trusts, they work with Public Health England at a local level and at a national level. So, you know, in terms of transparency and ways of working, they are absolutely integrated. They really are. With Public Health England and the NHS, with Simon Stevens in the NHS over the summer months. So it's wrong to say that we're not building capacity. It's wrong to say that, you know, communications are not taking place. They are taking place. But obviously, where there are increases in demand, which we are seeing, coronavirus trusts around the country.
There are other things I'd like to talk to you about this morning, but I do think that the way that you are portraying the testing environment in the UK at the moment seems very different to what many of our viewers are experiencing. Maybe we can come back to you on that on another occasion, because police recruitment is also an interesting area to talk to you about.
That we've had 100,000 individuals apply to want to become police officers across the United Kingdom.
How many of those are suitable? That was my question.
Well, we've already had over 4,000 that have become police officers. So they've gone through the training programme already. The college themselves, they work with the territorial police forces. Actually, we're investing in policing in record numbers. And when you look at the funding that has gone into policing, it's the highest level of funding in over a decade. That is right and that is proper. We are committed to not just investing in police officers, but also when it comes to protecting our communities, training police officers to address the very crimes and the type of criminalities that we see on our streets right now, and obviously trying to protect and prevent, you know, future crimes. Crime is evolving, whether it's online, whether it's fraud, whether it's drugs. Crime has evolved over the last decade. And
on this programme, Louise spoke to the Crime Minister, Kit Malthouse, who encouraged people to report their neighbours for suspected breaches of the new rules. Is that what you're asking the good people of the United Kingdom to do at the moment?
Well, I'm asking the British public to take personal responsibility for each and every one of us to, you know, be conscious and not spread this awful, deadly disease. You know, the fact of the matter is coronavirus is on the rise. The police were very clear in their discussions with myself and the Prime Minister that they wanted a simple rule that they could enforce when it came to numbers, but also targeting non-compliance. And we have seen pockets of non-compliance over recent weeks and months, 30 people or more.
You say do the right thing. Can I ask you then? I don't know what your neighbours are like, but if you saw 7 people in your neighbour's garden, would you call the police?
Well, I don't spend my time looking into people's gardens, but
okay,
what I would say.
But let me ask you, because I think this is important for our viewers this morning, because they're asking for clarity, and you're the Home Secretary.
Well, the clarity is that people should not be meeting. You know,
okay, but I'm asking you, would you report those neighbours of yours to the police?
I think anybody, you know, would want to take responsibility and ensure that we're not spreading this awful disease. And therefore, if I saw gatherings of more than 6 people, clearly I would would report that. And it depends on the circumstances as well, you know, where it'd be. But you've heard me say this already. You know, I've been working with police officers over months now, several months now, to do our utmost to stop the spread of this deadly virus.
Secretary, briefly, I can't let you go without asking you about what happened in the Commons yesterday. 30 of your colleagues couldn't bring themselves to back the government over the Internal Markets Bill. There is opposition in the House of Lords. Are you willing to compromise on this issue?
Well, I think first of all, there are important points to make actually about the UK Internal Market Bill, but also about the approach that we're taking as a government. Now, when it comes to preserving the integrity of the United Kingdom and clearly, delivering for the people of Northern Ireland when it comes to the Belfast Agreement, the Good Friday Agreement, we've said from day one. We've said this when the Withdrawal Agreement Act was, verified and went through the House of Commons and actually through the House of Lords, through Parliament, to absolutely make sure that we have the safety net and the right safeguards in place. That is also in line with our manifesto commitment. So there are no anomalies there whatsoever. We only had the second reading in Parliament yesterday.
Okay.
Obviously, this will go through committee stages, through the House of Commons, but Conservative MPs were elected on that manifesto to deliver for the people of Northern Ireland, to preserve the integrity of the United Kingdom, and also to fulfil that promise to get Brexit done. You know, we're still in negotiations right now with Kingdom, but also to preserve the, efficacy of the Good Friday Agreement.
Home Secretary, I'm not sure that answered my question about whether you're willing to compromise, but we are out of time. So thank you very much for being with us this morning.
It's just after 7:45, and Sally's talking about big money being spent.
Big money, yeah, a lot of money. Chelsea have spent big, and I think they're going to be a team to watch. They're going to be great to watch this season.
Very good morning to you. It's Tuesday, the 15th of September. In the last half an hour, the Home Secretary, Priti Patel, has told Breakfast it's unacceptable that people can't get coronavirus tests, but she insisted the government is growing its screening capacity every day.
She made those comments after hospital bosses in England warned that a lack of testing was leading to staff shortages.
Let's get more from our political correspondent, Chris Mason, who's at Westminster. And I know you would have watched that interview closely, Chris. What do you make of what she had to say?
I think it was a pretty candid acknowledgement, Lou, that things are not working as they should do, particularly in particular pockets of the country where there are spikes of cases, lots of people going online to try and request a test and encountering that kind of screen of doom where it says there are no tests currently available, and there's worries within a household that is in isolation, not able to work, somebody with symptoms and not able to get a test. And we've had loads of viewers contacting us, haven't we, saying, look, this is the experience we are having, either not being able to get a test or being asked to request one through the post, and that takes time, or being sent hither and thither all over the country, not being able to get a test locally. Priti Patel on our programme in the last half hour acknowledging that in some instances that isn't good enough, but she insists the authorities are doing as much as they can to ramp up capacity.
I haven't said there's not a shortage of tests. What I have said is that we are surging capacity in areas where we've had local lockdowns. And what I would say is clearly the examples you've given are unacceptable. And clearly there is much more work that needs to be undertaken with Public Health England and the actual public health bodies in those particular local areas. And, as a government, obviously, we work with Public Health England to surge where there is demand in local hotspot areas. And we continue to do that.
This is going to be the massive challenge of the autumn for the government. They're talking, aren't they, about Operation Moonshot, this idea of massively expanding testing capacity to millions a day. And yet here we are in September and they're struggling to turn around their existing capacity, just as schools and universities go back and the autumn and winter sniffles are likely to be in the air, and so the demand on the system likely to crank up. Massive challenge coming for the government in terms of meeting its promises, and for all of us trying to lead something approaching normal lives.
Yes, and there was test last night for the government over Brexit, wasn't there, in the House of Commons?
Yeah, so this is the Latest discussion around Brexit. The noise is returning. This controversy over the government wanting to put in place a safeguard, as it sees it, to ensure that trade around the UK, the different nations of the UK, can take place seamlessly after the end of the transition period, which runs out at the end of this year, and the UK is trading with the EU under different terms. Hugely controversial, this, because plenty say, look, this is a breach of international law. The government acknowledges that it could well be in certain circumstances. Last night, the government got its way. Sizable majority, 77. Only a couple of Tory MPs outright rejecting the plan. 30, though, deciding they had better things to do than actually endorse it. And there's plenty more noise as far as this is concerned to come in the House of Commons and the House of Lords. We've not heard the last of it.
I know you'll be analysing the noise. Thank you, Chris.
New rules to slow the spread of coronavirus come into force in the West Midlands today, effective.
And you did go out for us earlier in the programme to go and pick us some plums. Thank you ever so much for that. We've got lots here. What are these plums specifically?
So these are Shropshire prunes, and they are a damson. And these are actually going to a local gin distillery, Archangel, down the road. Yeah, I think that's kind of the fun bit, is all the different products you can make out of plums. And we also do have so next year we'll do a plum beer and hopefully be able to sell it in the orchard.
Great, so much exciting things to come. Just one really quick recipe idea. If people are sitting down having their breakfast, what could they do with some of these plums?
I would just roast some plums, and I mean, I find that plums from an orchard are totally different to the Victorias you get from a supermarket, which are sort of quite flavourless. And so just roasting some with some orange juice and some honey.
Wonderful, thank you ever so much. So if you're having your breakfast, plums are definitely on the menu this morning. Back to you in the studio.
Frankie, thank you very much.
Roasted plums. Lovely.
You're watching BBC Breakfast. It's 8:59.
With 46 different varieties, and I'm told that is very unique across the country. Now let's go bumper season for plums this year. We're speaking to Max, Andrea and little Lilia here, who's just become a little bit shy. Thank you so much for joining us this morning. So tell me about this bumper year for plums that we've had.
Yeah, I mean, it's been a strange year on many accounts, but it was weather-wise, really. We had that really hot dry spring, and that just meant that everything came on really quickly, and it was...
Frankie, thank you very much.
Roasted plums. Lovely.
You're watching BBC Breakfast. It's 8:59.
Let's take a last look at the news headlines for you this morning on Breakfast. And the Home Secretary, Priti Patel, has told this programme it's unacceptable that people can't get coronavirus tests. But she insisted the government is growing its screening capacity every day.
She was speaking after hospital bosses in England warned that a lack of testing was leading to staff shortages. And many people said they couldn't book a test either in person or online.
I haven't said there's not a shortage of tests. What I have said is that we are surging capacity in areas where we've had local lockdowns. And what I would say is clearly the examples you've given are unacceptable. And clearly there is much more work that needs to be undertaken with Public Health England and the actual public health bodies in those particular local areas. And, you know, as a government, obviously, we work with Public Health England to surge where there is demand in local...
Extra restrictions have come into force in parts of the West Midlands today. Back tomorrow from 6.
Yep, have a great day. Bye-bye.